Tonight we're in Beckenham in south-east London for our final programme before the Christmas break. Our audience, though, as always, reflects the electoral picture across the nation. Welcome to Question Time on BBC iPlayer and Sounds. From the government is the Health and Social Care Secretary, Wes Streeting. He's been pretty outspoken since starting that job in July, describing the NHS as broken and saying it must reform or die. Just this week, he warned the service is under record pressure heading into the winter. Nigel Huddleston runs the campaigning headquarters of the Conservatives as one of the party's co-chairs. Before the election, he worked in the Treasury with responsibility for the tax system. From the Liberal Democrats is Christine Jardine. She's held a number of roles in her party and now speaks of them on both Scotland and women and equalities. Before becoming a politician, she was a journalist for the BBC and for the Press Association. Emma Dabiri is a broadcaster, academic and best-selling author. Her 4 books discuss power structures, ideals of beauty, race and her upbringing in Dublin. She's also written columns for numerous publications and presented documentaries for the BBC and Channel 4. And Piers Morgan is the host of the YouTube interview show Piers Morgan Uncensored. He's also presented programmes for ITV and CNN. And before that, he was a newspaper editor, of course, first of the News of the World and then the Daily Mirror. Good evening, welcome to our panellists, and welcome to our audience here in Beckenham. Good to see you, and of course, welcome to you at home. You can follow the programme on iPlayer and BBC Sounds, as well as, of course, watching us on BBC One. Let's take our first question, which is from Michael Conway. Michael.
Are the government's new housing plans an assault on our green and pleasant land?
Right, so there was a discussion in the House of Commons today about this. The government's got a new policy framework to build 1.5 million homes. In some cases, the government may decide unilaterally whether a proposal should go ahead. In some other cases, it may be that planning officers can approve proposals without permission from the local council or input from local residents. Wes?
No, what they are is an attack on the situation we see in our country today, where too many people are priced out of decent homes, whether that's homes to buy or homes to rent. And for years now, and under successive governments, whether they're Labour-led, Conservative, Liberal Democrat-led in the UK, we have not built the number of homes needed, and this is a simple supply and demand problem. Unless we deal with housing supply, people will continue to be priced out of the housing ladder and people will continue to struggle to afford rents. And that is why the Deputy Prime Minister today has announced, as part of the plan that will be needed to deliver 1.5 million new homes, the planning policy framework that recognises that if we're to get 1.5 million homes, of course we want to do brownfield first, but we're honest about the fact we can't only do brownfield. And within the Green Belt, there are a number of sites which we are classifying as grey belt, which are not serving Greenbelt purposes and where housing would be suitable. For example, and to the gentleman's question, when we think about Greenbelt, we do think green and pleasant land. We think parks and open spaces or forests or lovely rural agricultural land. We don't think car park in Tottenham. We don't think disused petrol station. We don't think scrubland. But all of those things I've just described can be found in the current Greenbelt. So we are making that decision, and we are going ahead with this ambitious plan because I think we've had enough of sticking plaster politics. We've had enough of government by gimmick. We know this won't be popular with everyone, but we've had quite a lot of people trying to do the popular thing, and we've ended up paying a really heavy price to the country. So we're going to do the right thing so that people who come, especially from working class backgrounds like mine, or Angela Rayner's, our Deputy Prime Ministers, can have the same sort of security of tenure that gave us the chance to realise our potential and be where we are today, rather than being trapped in temporary accommodation, in bed and breakfast, and consigned not just to a childhood in poverty, but potentially a lifetime trapped in poverty. That's what we're trying to end. That's why the Deputy Prime Minister's leadership on this is so important.
So why did you oppose 850 homes to be built on Greenbelt land in your constituency?
Because that was...
Along with many other cabinet ministers, including Angela Rayner and Rachel Reeves.
Sure, and there were well-used and are well-used sports pitches that are used by kids and actually people of all ages from a wide range of backgrounds in my constituency, and I didn't think that that housing development was appropriate. I
but isn't that the issue, Wes?
And the campaign won.
Everywhere where local people or Labour MPs, as I say, cabinet ministers, are opposing these developments, there's always a really good reason for it. But that's exactly the thing that stops these houses being built. And you're as guilty of it as anybody else.
There's not always a good reason, but it's OK, by the way, and I'm sure we'll get quite a lot of this as the reforms go through. It's OK, actually, that whether it's MPs or councillors or members of the public, that if people don't think a particular development is right, that we speak up and we challenge. But it's also right that we're looking at it objectively as well, and that's what Angela Rayner's set out to do. So I don't actually regret defending those playing pitches, because that's really important for quality of life, for bringing kids, particularly from a very diverse part of London that I represent, for bringing kids from different backgrounds together to play sport. I think that's important. And there are going to be these sorts of choices and trade-offs. Housing won't always be appropriate, but it is important that we unlock the planning process, that we make it easier to build the homes that we need, and we get rid of the blockages that have stopped the number of homes needed, which have left people priced out of the housing ladder, or worse still, trapped in temporary bed and breakfast accommodation, where loads of kids in my constituency are today. And I tell you, if you sat in my constituency advice surgery on a Friday afternoon and met kids of primary school age describing in tears the conditions they live in, you'd want to build 1.5 million homes too.
So, Nigel, the Conservatives have been very critical of Labour's plans. I mean, you know, a lot of this comes to your door. You promised to build 300,000 homes a year. On average, it was 152,000.
It was 2.5 million since 2010, though.
It was nothing like what you promised.
But, well,
nowhere
one
near.
of the reasons being because the planning policy framework is actually very, very difficult. There's no doubt about that. But let's be very clear.
Well, why didn't you tackle it then?
Well, we did 2.5 million homes,
yeah, but
Fiona,
you were nowhere near your target,
including
as you
a million in the last government, you know, despite the pandemic. So, actually, we've got a much prouder record on housing than many Labour
you
governments.
all the housing targets
the many...
Well,
Wes, the hypocrisy is astounding from you, not only on an individual level in terms of don't want building here, you want it in the countryside. It is absolutely incredible you can say this. This is transparently yet another attack on the countryside. This is Labour, generally Labour cities, trying to solve their housing problems by building on generally Tory-run countryside. This is another attack on the countryside. We need more housing, there's no doubt about that, but it needs to be in the right place and the right scale with appropriate consultation. This is Angela Rayner sitting in Whitehall telling all of you what she wants you to do, and she wants to build on your countryside and in your area. And Labour MP after Labour MP, I think 14 of the ministers in government at the moment, when it comes to their own development in their own areas, they go, not here, thank you very much. So, look, we do need to solve this problem. We do need more housing. But the idea that the city's problems can be solved in the countryside is not the right route. No way.
Man there in the middle.
Isn't the fact is that there's 150,000, up to a planning application for 150,000 houses have already been granted, and the builders have just been sitting on it and not building. So the builders can only build what they can sell, and they cannot just build that 1.5 million houses in 5 years that you're promising, because they can't sell them.
All right, I'll come back to you on that, Wes. Let me hear a bit more from you. It's Ben in the green top.
Yeah, I agree. I mean, there's people... My generation, it's a pipe dream to own a home, really. It's so expensive. The consensus hasn't worked. The Tories have had 14 years. They haven't built the homes we need. If Labour need to change some of the rules, make it easier, grease the wheels, if you like, then that's what we need to do. We need more homes.
All right. Michael, you wanted to come back in. You asked the question.
Yes, I applaud the government's intention to build 1.5 million affordable homes, but we've already heard from the panel about the challenge of the infrastructure to be able to do that. But good luck to the government in the delivery of this pledge.
OK. Piers.
It's all going to happen. Sorry, Wes.
Oh, you really are the Grinch this Christmas, aren't you?
I don't want to be the Grinch. It's just not going to happen in the same way that the promises we got from the Conservatives didn't happen.
2.5 million homes, Piers.
Yeah, but it wasn't what you said it was going to be, which was massively more. And you say 1.5 million by when?
By the end of this Parliament.
OK, great. Let's have a bet. £1...
Not this again. We've seen where this goes with all of your bets.
The British Prime Minister last... Your guy, Rishi, didn't pay up in the end, but a pound to charity, a pound for every home you don't build up to 1.5 million by the end of the Parliament. You taking it?
Unlike Rishi Sunak, I don't have that kind of money, Piers.
Right, exactly. So you're admitting you're not going to hit the target, is my point. And look, I'll tell you a little story. Notre Dame. We all watched the amazing scene of Notre Dame being reopened. 5 years they rebuilt this incredible cathedral, and the world went down there, and it was amazing. And I remember walking near Notre Dame just after it had burned down. I thought, there's no way they're going to build that in 20 years. It looked destroyed. But they did it. They did it because they had a will to do it. Let me compare and contrast to an iconic monument in London, which is Hammersmith Bridge, which is near where I live. Hammersmith Bridge, in the same year, 2019, got cracks. So they stopped all cars going over the bridge. And 5 years later, it's still not got any cars. And we're being told it's going to be at least another 5 years. In fact, it may never reopen to cars. How can that be possible in a country like this, which used to be a world beater? We can't even repair cracks in a major bridge. So people in West London have endless traffic hell because we just can't get our act together. Why can't we get our act together? Because the great planning experts over there from the Tories, this is Grant Shapps, decided when he was Transport Secretary that the cost should be split between Department for Transport, Transport for London and the Hammersmith and Fulham Council. And they literally cannot get their act together to do anything. And I was reading the other day, just on this same theme, Britain hasn't built a reservoir since 1992, despite a growth in population of 10 million people. Each mile of high-speed 2 is costing 4 times as much as high-speed rail in Italy, and 8 times more than high-speed rail in France, and so far ours doesn't even exist. And the planning documentation for the Lower Thames crossing comes to 300,000 pages, and the project has so far cost £300 million. No building work has taken place. Norway spent less than half that amount on actually building and opening the world's longest road tunnel.
So do you think...
So my point is...
What is your point? Do you think the government is right? I mean, Michael Conway is your...
Well, I agree with what...
Is it an assault on our green and pleasant land?
Well, I don't think it's that, although you've got to be careful. Look, 91.7% of Britain is undeveloped. Let's get it in context. I don't think that's the big issue. In principle, I totally buy into what Labour are doing. I've got 3 sons from 31 to 24, and it's incredibly expensive for any young people now to get on the housing.
All right, let me bring Christine.
So I hope they're right. I just don't think they can deliver it.
Christine.
Well, the principle I agree with, because we have a housing crisis. We need to build more houses. We need to target them. We need to make sure they are the right houses in the right place. And the point the gentleman made about the developers sitting on developments and not being built is because at the moment we have basically a developer-led system where the developers want to build houses. They build houses. Now, the flaw I see in Labour's plan is that they're not actually following what communities want and communities need. We need to build the houses where the communities want them. Now, in Kingston, in Ed Davies' constituency at the moment, there's a project which has been completely community-led, Cambridge Road project, I think it's called. They're building 2,000 homes. They are redeveloping the area. They're building them where the community wants them, where the infrastructure is. That's what we need to be doing. And the other problem with Angela's plan is that if she makes a decision in Whitehall, it's not community-led, it's not responding to what the community want, and it might be open to judicial review, and then we'll have more delays. And the houses that we desperately need will wait longer.
OK. You've got a question here at the front.
I think it's more nuanced than that. There is this land bank, but we're trying to build 2 accessible homes. Individuals trying to borrow money is really difficult, and I think it would be very simple for a government-backed guarantee scheme where individuals could apply that's outside the normal mortgage system, and I think that it's not going to open up millions of homes, but it will certainly make a substantial difference to where people want them to be built.
OK. The woman there in the dark top there in the middle of the row.
We need first-time buyers to be able to buy things, and we need builders to be able to build things. So surely we need to look at bringing Help to Buy back to make it affordable for first-time buyers and to make it profitable for builders to do what we need them to do.
I agree.
Doesn't Help to Buy, though, in many ways kind of worsen the situation if there's not also more houses being built, if there's not more supply?
There was some suggestion that Help to Buy push prices up.
Help to Buy pushes prices up. So Help to Buy can coexist, but there desperately needs to be more houses built. That's what's absolutely key. And I think it's just really defeatist, Piers, to be like, it's just not going to work. I, too, suspect they may not be quite able to achieve their stated aims.
I mean, you've got house builders saying we're going to need 150,000 more tradespeople, for example, just even
Well, exactly. There's a massive labour shortage, and that's one of the things that we can, you know, possibly blame on issues with immigration in the country and people not being able to come into the country as easily as they previously were because of Brexit. But I don't want to get sidetracked.
Well, hang on, nearly a million.
Immigration's gone up. There is a labour shortage.
I don't think that's the problem.
There's a labour shortage. But like I said, I don't want to get sidetracked by that. There's not just a housing crisis. There's like a housing catastrophe. Like it's absolutely shocking that in this country there's such inadequate housing and such a shortage of housing for people. So I think the intention of building this 1.5 million, the intention of building this many houses is admirable and is necessary, even if they don't achieve it.
OK, well,
that's what we need to be working towards.
Let's come back to you. So first of all, we had the woman over there saying that why don't we reintroduce Help to Buy? And then you were talking about 150,000 homes where there is planning permission, but they're just not being built.
There's definitely a challenge of land banking. I think the virtue of this target and the mission-driven way the government is approaching these big targets is it's all of the things we've been talking about. It's making sure you've got the right skills, making sure you've got the right raw materials, making sure you've got the right planning policy framework, making sure you've got the right investment environment.
Help to Buy?
And Help to Buy would absolutely work effectively if you've got the supply rather than price people out. So there are a range of things that we need to do, and the point is you do need to do all of them. And that's why what the Prime Minister was saying last week with Plan for Change and the big targets in there are really important, because it gives the whole government and industry something to focus on, so we're all pulling in the same direction. Having these sorts of conversations where you work out, as a country, what you need to do to achieve a really big and important target, and you pull together to make sure you deliver it.
How is whacking up stamp duty going to help with affordability? How is, given most of the need is actually in the cities, where you've just today announced a reduction in the house building target in the cities, and you're putting it into the countryside? How is that all sensible? You can understand why so many people across this country genuinely believe this is yet another attack on the countryside. You don't understand what it's like in rural areas. You are trying to solve the city's problems in the rural areas. It won't work because lots of people don't want to move to the countryside either. So you are trying to solve the city's problems. Why don't you focus? Why don't you get Sadiq Khan and others to focus on the cities and solve their problems by house building in their own areas?
Let me just say three things really briefly. Firstly, in my London borough, thanks to the Mayor of London and our Labour Council, we are building more council houses in Redbridge than we've had for generations. Secondly, to your point on hypocrisy, I have been willing to take on views in my own constituency, in Hainault, for example, where we built temporary accommodation, because I thought that accommodation would be better than kids being stuck in bed and breakfast, and I had lots of local opposition, and I lost votes over it the election before last. So I'm willing to take on unpopular arguments to do the right thing. And thirdly, Nigel, when it comes to criticism of this government, the things we get right, the things we get wrong, we will absolutely take the criticism on the chin from the voters, whether you voted for us or not, because we work for you. What I will not do is take lectures from the party that trashed this government over the last 14 years, has not shown a single shred of responsibility and hasn't even had the decency to say sorry for the mess you left this country in.
All right, OK. Shelley, I'm just going to... I want to fit some more questions in, so I'm going to leave that there for now. Before I move on to our next questions, I want to fit 4 in and give them all a decent outing. I just want to let you know this is our final programme before Christmas. We'll be back on January the 16th, and we will be in Northampton for that programme. And the week after that, we're in Stockport in Greater Manchester. So Northampton and Stockport. And if you'd like to be in the audience for either of those programmes, go to the Question Time website, follow the instructions there, and hopefully we will see you. Northampton and Stockport. Right, let's take our next question now. It's from Susan Richards.
Why does the NHS wait so long to treat people, causing people to become sicker and more expensive to treat?
Well, look, where's your health secretary? Obviously, this is a question that's going to come to you, but I'm just going to get around the rest of the panel just for a moment. So, why does the NHS wait so long to treat people? Nigel, obviously, a lot of this is built up under the Conservative administration.
Well, it has, but Wes just said, you know, what did you achieve in government as well? 4 million more jobs. And then when it came to the NHS, by the way, which is an immensely complicated system, we're all proud in the NHS, but let's not pretend for 1 minute that the answer is always throwing more money at it. It needs to be more efficient and more effective. And that is one of the key goals. Now, over the last 14 years, we've spent 1/3 more in real terms on the NHS. But the focus isn't just on the inputs. It needs to be on the outputs. And the point you're getting at there, and I said, you know, I'm a former sports minister, and one of the problems is, around the world, the sports minister is usually part of the health system, health minister, because it needs to be focused on where we can improve physical activity, health and well-being. We don't really have an NHS, it's a National Illness Service. So an integrated approach is key, and making sure that we get everybody fit and healthy and active is part of that as well. But in terms of the timings, you are right. We need investment in the NHS. It needs to be particularly focused on IT, which is a real challenge, and actually Jeremy Hunt's last budget really focused on that. But focusing on outputs and outcomes, not just constantly looking on who can spend most and having the arms race on who spends most.
Are you proud of the Conservatives' record on the NHS?
Well, the outcomes, actually, significant improvements, and more people actually were served by the NHS, and of course 50,000, I think,
significant improvement in the NHS in your tenure.
No, I said in terms of some health outcomes. But
sorry,
I have to, Piers,
sorry,
Piers, I'm not going to pretend for 1 minute we did not get everything right. You cannot have a straight face and tell the British public you made significant improvements in terms of NHS. Health, in terms on of almost every metric of the NHS. You lot were a total disaster. Don't put words in my mouth.
Go on.
OK, so I said there are significant health outcome improvements in terms of the NHS. Many of you will have had positive experiences with the NHS. Many of you will have had operations that didn't exist 20 years ago.
Let me tell you my experience. All right, let me tell you my experience.
Lots of people had
Let me give you an example.
I'm not going to pretend for 1 minute that we got everything
Nigel,
right.
Let me give you an example which I suspect will resonate more with the audience, because they probably all have similar stories. About a year ago, my mother had a heart attack and ended up, after being diagnosed with a heart attack, spending about 8 hours on a trolley in a corridor in A&E down in the South Coast, and there were 35 other people on trolleys there, and I was then sent letters by people when I talked about this who said that their relatives had died in that corridor waiting to be treated. Now, when she got the treatment, it was fantastic. We have world-class doctors, nurses, surgeons and so on.
That's exactly what I was saying.
But our A&E units are like war zones, and successive governments going back a long time now have absolutely failed the NHS as a system and a service and the people who work in it. And to try and pretend otherwise... I didn't pretend otherwise.
All right, and do you think Labour has the answer?
You know, I like Wes. Not just because you're an Arsenal fan, but I do like him.
But look, think about Susan...
No, here's my point. My point is that when I hear these pledges that come out, right? I mean, the last time I appeared with Wes on the BBC, you couldn't even remember the last 6 pledges you'd come out.
I also couldn't get wording. She was on with Nigel Farage, so I was just sort of...
No, it wasn't on here, but I remember you couldn't remember because there were 6 pledges. It was just too many. Now there's another 5. That's 11 pledges this year we've had from the Labour Party. And you keep making pledges, just as the Tory governments did consecutively, about the NHS. I don't want to hear any more pledges or promises. I actually think that we could just wait and see if we feel a tangible improvement, and people will know, and the figures will be what they are. Stop promising us things that you can't deliver. Just make it better.
Woman at the very back.
Okay. Well, I'd like to say, first of all, I think we're all absolutely sick and tired of listening to you guys kick this back and forth, parliamentary term in, parliamentary term out. What I can't get to grips with is why do we never hear from the people running the NHS? And I think the name that comes to mind is Amanda Pritchard. Now, I watch a lot of current affairs shows and listen to the radio, and she is the grey woman of the NHS. So how do we get to hear more from the people who are actually running it and will probably still be there when you have all moved on to your reality TV shows or Strictly Come Dancing, etc., etc. Thank you.
Man here in the blue jacket.
Very good.
Yes, Wes, I think I hope you can do a good job with this. I really genuinely do. My experience of the NHS, my father was in hospital, sadly, at the end of last year. He went in with a complication on a hip replacement that had done. Within a week, it was solved. He was in hospital for 9 weeks because there was nowhere for him to go. There was no way to get him home. There was no local support. So he blocked a bed for 9 weeks when he needed to be there for 1 week. Governments continue to say, we're ploughing money in, we're ploughing money in, we're putting more money in than you, more money in than you. Where's it going? What are you doing with it? Letters come after an appointment through Royal Mail. You get a letter a week after the appointment's gone.
Yeah.
And then you're penalised for missing the appointment. We need to get a joined-up way of working, whether this is cross-party, involving people from the NHS, whatever we need to do, we've got to find a way to connect this up together.
Now, Wes, I know you've talked about wanting to get cross-party working on social care, and you're just trying to work out a way of doing it. When can we expect a plan for social care?
Well, in the new year, we'll have more to say about that. And since the general election, just to recap, we've had fair pay agreements for care workers in the Employment Rights Bill. That will be the first fair pay agreements ever in our country that will improve our ability to recruit and retain care workers and value them as care professionals, the biggest expansion of carers allowance since the 1970s, and as well as more funding for health and social care and local government in the budget, there was ring-fence funding specifically for social care.
You've
now,
also had national insurance employers' contributions, which care homes have said means they may have to lay care workers off.
I'll come back to that in just a moment, that's an important point as well. I'm not pretending that those three things are the panacea to fix everything in social care, nor am I going to sit here and say that ending the junior doctors' strike with a resident doctors' deal in a few weeks after office has solved everything, or the 1,000 more GPs we funded onto the front line solves everything, or any of the other measures that we've taken, particularly on public health, the mental health bill in Parliament, tobacco and vapes.
Now you're just trying to list your achievements, Wes, but actually what the man here wants to know is when will social care be sorted out?
Yeah. Well, just two things. Firstly, I think it is important that we report back on what we're doing, point one. Secondly, that we're also clear that we don't think that this is job done, problem solved. This is going to take time, and we're building, as well as the action we're already taking on the NHS, change.nhs.uk, the biggest national conversation we've ever had.
Hang on, I still haven't got an answer to this manuscript. When can we expect to see social care, a plan that is going to work?
I've just told you we were setting that out in the new year.
Wes, you've scrapped the plans that we had in place.
Nigel, I just refer you to my previous answer on this with regards to you. I mean, you won't even acknowledge the scale of the challenge in the NHS. No wonder you didn't solve it.
Certainly do.
The final thing I want to just say, because I think this is important in terms of the broad sweep of the NHS. Why are we in this mess? It's partly the top-down reorganisation that spent billions of pounds and set the NHS back. It's partly because even when money has gone in, so, for example, we had a big expansion of staff working in hospitals. It's the wrong people in the wrong place. And so that's why I've talked so much in opposition and now in government about the need for investment, yes, of course, but also reform to the way that the NHS works. We have to improve the productivity of the NHS. So on waiting lists, for example, we're not just investing more to cut NHS waiting lists and ramping up to the 40,000 more appointments a week that we promised. We're also changing the way we do those clinics, taking some of the best practice in some of our top hospitals so that we can get more people through in a single day.
Let me hear a bit
So we're reforming the way the NHS works.
Okay.
This is going to take time,
from some of the
but we've got a plan to do it, and we've got the record. And the biggest tragedy of all is that we did deliver, when we were last in, the shortest waiting times and the highest patient satisfaction in history, which is why my predecessors, my Labour predecessors, were able to say unequivocally they were proud of their record. Unfortunately, our predecessors can't say the same for theirs.
Man here in the red tie.
Yeah, so, I mean, now the GPs are finding innovative ways of delaying appointments. For example, now they've introduced a triage system. So, obviously, there's a shortage of doctors coming into the system. So what is the Labour's plan to introduce, incentive for students to join medicine and for more graduates coming into the profession?
OK, let me move around a little bit before I get back to you. Yes, you want to say something at the very back. Yeah, no, just behind you.
When the NHS was founded, I think the population of the UK was 50 million. The population now is over 70 million. So it's all good pumping money into the NHS, but what's the point in pumping money into an organisation that isn't really working anymore with our much larger population?
So would you rather see something other than the NHS?
Yeah, I think a system like in France, where the people who have enough money can pay into it, and then the people who don't have enough money don't have to pay into it, and the system just works a lot better.
OK. Woman in the blue top.
I would love to see a cross-party group working to fix the NHS, but do you really think that could actually happen with the very different values? So Labour came in, sorted out all the issues with the doctors and the nurses, stopped the strikes, and immediately the Conservative Party then completely attacked them for that. So with such inherently different values, could that actually really work?
Can I just come in on this? Look, I'm sorry, but they spent your money. They didn't negotiate anything. They didn't have any
Hang on,
improvements in
that's
outcomes.
not what the woman there was saying, which is why you're looking like that. She's asking about cross-party working, given that you're kind of different. Are you prepared to do cross-party working?
I'm always
or
prepared
do you just want to sit here and criticise each other?
To be honest, actually, there's a lot more cross-party work goes on in Parliament than you see.
So the answer
a lot
is
of the
yes.
Time. Always
okay.
willing
Let
to
me
this.
hear from
But
Christine.
wait, can I finish this point? Because on the solving the dispute, it was by basically giving them everything they wanted to, with no conditions attached. And this is what I'm saying. It wasn't just throwing, it was more money being thrown in with no better
I'm sorry,
outcome.
this is like the arsonist attacking the fire brigade for not putting out the fire task.
Let's hear from some other people on this panel.
Your strikes cost billions of pounds in the cost of backfilling those strike actions and saw over 1.5 million operations, appointments and procedures cancelled and delayed. That is a heavy price for failure. We are cleaning up your mess.
Christine.
Actually, I'm really sorry, guys, but what we've just seen is an illustration of the problem and the point that the lady made. You sat here and you argued about strikes and about pay deals. People want to see the NHS working. The original question was, why is it taking so long? It's taking so long because you're not addressing social care, which was the other question. You're not coming up with a system to get people through hospitals, get them the social care. If we had free personal care, we could get them out of hospital much more quickly. The package is there to free up the hospital beds. And yes, we need to work cross-party. We've offered to do it, but you know what? We need to stop arguing about the political side of it and talk about health, getting the health service to people, depoliticising the NHS. Ideally, none of us would have anything to do with it. It would be run by people who know about medicine and who don't care about the politics.
And then maybe you'd hear more from Amanda Pritchard, which was the point you were making. Emma.
Yeah, I think, unfortunately, like my positive feelings to the attempts with housing, to the announcements that have been made about housing, I feel like a lot more, I guess, trepidation and concern about what's going on with the NHS. And I even feel like your strategy shifts, Wes, are... I don't know why they are the necessary strategy shifts that would be required. So from hospitals to community for
prevention.
Yeah, sickness to prevention. And then analogue to digital sounds great, but I think when you dig a little deeper into it, I would have questions around that as well. And I think there's the real fear and suspicion with you that you're perhaps like lining the NHS up for more privatisation. And a question that I would like to ask you is why so much of your donations come from private healthcare, your personal donations come from private healthcare individuals and companies, because I think that kind of suggests something of a conflict of interest.
Well, I'd say a few things in response to that. Firstly, we don't have state-funded politics or political parties. We do have to fundraise, and there can be no conflicts of interest, not least because I don't have donors who are directly providing private healthcare. Any that have tangential links to private healthcare, there are strong governance arrangements so that I would never be involved in decisions that could be actually benefiting or perceived to benefit my donors. That's the first thing.
Emma's looking very
the second thing, and it's OK to be sceptical. The second thing I would say is in terms of NHS privatisation, we'll privatise the NHS over my dead body. I understand the cynicism of the guy at the back there about whether we will be able to afford an NHS free at the point of use. I think there's lots of anxiety, unprecedented anxiety about whether that's the case. But, you know, that fundamental principle of an NHS free at the point of use is a principle of fairness. It meant when I went through kidney cancer, the one thing I never had to worry about was the bill, and we should cherish that. When I look at other healthcare systems and why they perform better, there are lots of underlying reasons about how they deliver healthcare, but the model of funding isn't one of those reasons. And the final thing I would say is, to Christine's point about you haven't done this, you haven't done that, if we're here in 4 years' time, I think that would be totally fair. Bear in mind, we've only been in 5 months. That's why, Fiona, by the way, I was keen to list the things...
But it should have been top of your list.
But I was keen to list the things that we have been doing, because it's important people know we have hit the ground running, we're going as hard and fast as we can. Change is going to take time, real change always does, but we can do it.
What happens if you don't hit your targets? I mean, you want them to be held accountable, quite rightly, for 14 years of failure. But if you, in 4 years' time, have substantively failed to hit these targets, which is why I don't think you should keep setting endless targets anyway, but if you don't hit them, where's the accountability? Would you say now, to the electorate that if we haven't hit them, you should not vote for us in the next election?
Two things. Firstly, I had accountability this afternoon when the Prime Minister was in my department asking how I'm going on cutting waiting lists.
No, I mean to the electorate.
And then I get accountability from the electorate, and so do we. And just to say, finally, because I think your point, Piers, about people don't want plans, promises, I think that's a fair challenge, actually. I just want everyone watching, whether in the audience or at home, to know we know how we're going to be judged. We know we're going to be judged on results and delivery now. That's the opportunity that you've given us by being in government.
All right.
And we know that by the next election, we have to be able to knock on your doors or put leaflets through your letterbox that show how this country is in a better state at the end of this Parliament than it was at the beginning. All I'm saying is give us some time, give change a chance. It does take time. We've hit the ground running.
I think the words like change and reform are coded positive, but they're very nebulous. So I have concern about the change and the reform. And I don't understand the priority from hospitals to community. I don't understand why that is such a kind of pressing priority. And I feel that already there are so few, there are not enough hospital beds. Why is the priority to have kind of less investment in hospitals? And how will complex care be catered to in the community?
It's a really good question. So what it means is, because people can't get a GP appointment, which costs the NHS about 40 quid, they end up in A&E, which costs 400. So when I say hospital community, I don't mean shutting hospitals. What I mean is better access at the front door of the NHS, care closer to people's home, often in people's homes. That's how we deliver better outcomes for patients and better value for taxpayers' money, so we can deal with the point about the NHS
Let's move on.
Longer term.
We're not going to get our questions in. I want to take a question now from Alexia. Alexia Zavu. Yes, there you are.
Following the tragic news about Sarah Sharif, is it time to tighten legal requirements around elective home education?
So, listen, I'm sure you don't need me to remind you of the details, but let me just say, so Sarah Sharif was 10 when she was murdered by her father and her stepmother, endured horrific suffering, and she was taken out of school and homeschooled. And then she was out of sight, out of mind, and she died. Now, look, let's just take it as a given, because we're reasonably short time, and I want to get through these questions. You don't need to tell us all how awful you feel about what's happened. It's unspeakably tragic. The question is it time to tighten legal requirements around elective home education? Christine.
Well, I think we do have to look at it very carefully. And one of my colleagues, Will Foster, is the MP for the area in which the family lived, and he's called for an inquest into this. And this is one of the things that we need to look at. Like probably everybody else in this room, I am so tired of hearing of these cases and us saying we have to learn lessons and it mustn't happen again, and then it happens again. And I think this time we have to, as the lady said, we have to look at how it happened and how it was that no one knew that this child was being so horrifically abused. And perhaps it was because...
They all knew.
Yes,
everybody knew. I mean, that's the point, isn't it? I mean,
the fact that she was taking...
but the scandal here is that everybody knew.
As the lady was saying, she was being homeschooled, so perhaps, yes, we do need to look at how, if a child is taken out of school and there are these suspicions, we look at it. And we do, first of all, need an inquest to look at the circumstances in all of this and try this time to see where the mistakes were made and change it.
Piers, so you've got the Children's Commissioner, Rachel D'Souza, saying there needs to be some kind of system where if a child is known to be at risk, as Sarah was before she was even born, children like that should not be homeschooled, and they should be registered for homeschooling anyway.
Yeah, I mean, this poor girl, Surrey County Council made her the subject of their child protection plan when she was born because of the ongoing allegations of violence against her father. He was arrested for attacking 3 different women 3 different times. He was attacking his siblings. He was a known violent person. And yet, despite that, she ends up with years of torture, being punched, being strangled, battered with a cricket bat and a metal pole. Her back was broken 10 times. When she died, they found 25 fractures and 71 external injuries, including bite marks and burn marks from an iron. That's what she was sent back to finally endure. And I think the school failed. It's not enough to just say we're concerned about these bruisings, and then when she's sent home, that's it. The police failed. They knew this guy was dangerous. They knew that he was clearly, there was stuff going on with this girl. Nothing happened. The family court failed her, and the social services failed her. And it's not the only time they failed. And each time we have one of these cases from baby P onwards, we keep being told lessons will be learned. They're not being learned. And these kids should never slip through the cracks. I mean, there were 15 different occasions throughout all of these official bodies where somebody should have stopped this. And 15 times she got failed. Yes, she was failed by a despicable, monstrous father and stepmother. Yes, of course. And they're the most blameworthy of all. But every single other person whose literal job it is to protect children in this situation spectacularly failed that girl, and that is why she's dead. And if this ever happens again, where you have so many years of abuse, and everybody knows, then the idea that she gets allowed to go home to be educated by the monster who's abusing her, and that's it, and she has no escape, is a complete outrage in this country and has to be stopped.
Emma?
Yeah, I think the emphasis on homeschooling is misleading. We hear of these cases, of similar cases, horrific cases, of children who were in school as well. And as you said, the school was aware of these injuries and they were reported. And I think it just goes back again to just the crumbling, dysfunctional infrastructure of the country and the lack of support and funding and resources for social services, for children's services. These things are, chronically underfunded, so there's actually often not capacity to look after the vulnerable people in our society.
Let's hear a bit from audience. This woman there with her hand up. Yes.
Yes, so my mother, she worked as a social worker for many years, and she constantly talked about how understaffed they were. And basically, she was actually a contractor, but even then she had such a massive workload, and she certainly felt very guilty that she couldn't get to everybody that she needed to. And I think there really is a problem of resourcing. I know this question is around homeschooling, but I think what this has shown is the wider issue, because even things like Sarah Sharif, she actually wore a hijab, for instance, and even nobody sort of took any notice. There were no alarm bells there. Even just suggesting that, she was covering bruises. And so I think there is a wider issue, not just around homeschooling, but just this joined-up thinking, say, between the social services and the educational system. And that's where the failings were, and sadly she's no longer here.
I completely agree. The homeschooling is a distraction, almost.
Well, she wasn't homeschooled. She was home-tortured.
Yeah.
Let's not kid ourselves.
Yes, in the white shirt there. Yes, you've got your hand up in the middle towards the back. Yes. Yes, you.
How do we stop all these cases, like, slipping under the cracks, almost, because they happen far too frequently?
They do happen far too frequently. And as you say, we keep hearing lessons are being learnt, and then the same mistakes seem to be made. Yes, the woman in the middle there in the brown shirt.
Hi, so I am a deputy pastoral manager in a special needs education school at the moment, and we've had cases where it's out of our hands in the sense of some children they come to our school and we don't meet their needs, so then they're almost sort of put out of the system and at home for lengths of time, not in any sort of educational needs. And my role obviously is to build those bridges between the school, home and throughout. And I'm being used to sort of patch up areas in the school of, understaffing, managing behaviours, and being used at sort of every resource throughout the school, when actually really what we should be doing is focusing on those situations.
And do you think a register, as Rachel D'Souza, the Children's Commissioner, has called for, a register of children who are being homeschooled? I mean, at the moment, there is no central register, so there's no way of checking up. Do you think that would be, with your experience,
well, yeah,
would that be a good thing?
Absolutely, because we've got autistic children who are non-verbal, who can't communicate, and we need to take that out of their hands and protect them from all of those situations.
I mean, whereas another thing that Rachel D'Souza talked about today was not just a register for homeschooling, as Alexia is referring to, but also having a central system whereby a child, the way she put it was, a child has one individual number. So the NHS number, the number given under social services, the number in education, it's always the same number. And she says she's been trying to get this for years, and every time she's told it's just too difficult. As Health Secretary, is that something you could make happen? And would you want to make it happen?
Yeah, so two things. Firstly, we are going to bring in a homeschool register. We are going to legislate to do it. It was in the King's speech, and this case shows, tragically, Why? It's not panacea, it won't solve everything, but it is absolutely necessary, and we will face down the opposition to this measure from lots of well-heeled homeschoolers who think that it's all about, you know, lovely trips abroad and a wonderful kind of enriching environment at home. There are real child safety issues, so we are finally going to bite the bullet and do this. The second thing, what Rachel D'Souza said about the children's identifier, we are going to look at, because what you need to be able to do, and I don't want to prejudge what's happened, because I've agreed with every word Piers said about this case, and what's hard about this is the range of interactions the state had with that girl and that family, and still failed to save her, and still failed to take her out of harm's way. So whatever we can do to make it as easy as possible to join the dots and identify patterns, we absolutely must do this. It's quite easy, and that's why, in terms of the NHS, we are going to have a big push on how we do better join up of our systems, because on patient safety failures, for example, if we can look at patterns and trends, we can improve the system and we can improve patient outcome. So I think this is an important thing for us to be doing as a government. But in terms of child safety, child protection, children's social care, this is a big priority for us. And the Education Secretary announced a wider reform package off the back of Josh McAllister's review of children's social care. And we have got to do more to keep these children alive, safe, well, and free from harm, particularly where that harm comes from their own family.
Nigel.
Well, the specific proposals...
Would you back a register?
I think it makes common sense, and because actually one of the... You know, you see us Barney here, you see us Barney in the House of Commons. What you probably don't see so much is when we go back to the constituencies and do surgeries and meet with schools and social workers. These things are all too common. They really are. And we hear heart-rending stories in surgeries and so on about terrible abuse going on. Now, let's be very clear. The blame lies with the evildoers and the people who are killing and abusing their children. What society does then, in terms of the institutions, the family, neighbours and so on, we've all got a part to play here. One of the concerns I've got, though, is if we start to do the blame game everywhere, who would want to go into social work? Who would want to do these things? Because I think the challenge is, it makes people a little bit afraid to raise their hand and say there's something wrong here, what's going on? Because, you know, there's some... If you don't feel like you're going to get that support, if you don't feel like your role, in particular in social work, is seen as hugely important, and people will be there to back you up when you do stick your neck out, then I think there's something wrong there as well. So there's no easy solution to this. What you're proposing, Wes, seems eminently sensible. But, you know, let's just be a better society as well.
Also very firmly lies with, like, the 14 years of, like, Tory government and just, like, the gross, like, austerity and, like, defunding and asset stripping of the country as well. So I actually find it, like, interesting for you to just sit there and bold-facedly talk about blame and not take any kind of, like, accountability for, like, what your government has done to this country.
Well, and as I said earlier on, I'm sorry, I will say this. We did not get everything right in the last government, and I will apologise now for the mistakes we made. Every government will make mistakes. We also had pretty difficult circumstances. But also, can we just stop this narrative? 4 million more jobs over the last 14 years.
I'm sorry, even your attitude when we were...
Hang on, we are a million miles from the question. Wait a minute, which is what everyone's talking about.
We just got the 14 years of austerity argument.
When we were talking about housing and you were bringing back a really... Where's the sense of national identity? When we were talking about housing, you're doing this very divisive... there's no... OK, one of the problems with housing in this country is that...
I think you're talking divisiveness by saying...
I'm not... No, is that local councils can veto national targets with housing. I don't want to go back to housing too much, but just when you were... OK, so they're
just getting quite far off the question.
I know,
and I want to get another question.
I think this point is important to make very quickly. So the fact that, like, local authorities, local councils can, their objections can scupper national targets around housing. OK, is something that the government now, the new Labour government, seems to be really trying to address by saying they're going to
briefly
build
because we dealt with this at the beginning of the programme.
Yeah, I know, but I didn't get a chance to make this point, and I think it's important. But Nigel's narrative was very much like, oh, it's the towns against the country, and this is the narrative that is preventing.
Well, where's the house building?
Hang on, I'm going to stop this here because we dealt with this issue, and I've got one more to get in, which is a really important issue. We've got now not that much time to it, but we're going to do it anyway. So Lucy, there you are. Let's hear your question.
As President-elect Trump wants nothing to do with Syria, Just how involved should the UK be in rebuilding it?
Piers.
Well, look, first of all, it's brilliant that Assad has gone. I think we should be crystal clear about that. He could have gone in 2013 if Labour had got their act together and not voted against military action that David Cameron, the Prime Minister, wanted to take. And by Labour voting that down under Ed Miliband's leadership, Barack Obama then bottled it. And out of that came Russia siding with Assad. And out of that came all the mayhem, not just in loss of life and appalling scenes in Syria, but the enormous numbers of people who then left Syria and migrated across Europe, causing all sorts of problems in all sorts of countries, not least for the poor people that were being displaced. So it was carnage which we could have stopped as a country, I think, back in 2013. And Ed Miliband's been very quiet about what he did back then on behalf of his party. And I'd be interested whether Wes, now, who wasn't involved, blaming you, whether you would agree that that was a big mistake with hindsight.
Well, we've only got 4 minutes left, so shall we ask Wes that question?
Yeah.
Look, with hindsight, I think we can say, looking back on the events of 2013, that the hesitation of this country and the United States create a vacuum that Russia moved into and kept Assad in power for much longer.
So that was a mistake by Labour.
And hang on just a second. What I cannot say with certainty, and what we can't say for certainty even now that the rat has fled to Moscow to his backers, we cannot say that the back of Assad is going to lead to a better Syria yet. We don't know. It's too soon to judge. There are some encouraging signs, which range from the fact that the new regime is working with the international community to hand over chemical weapons stockpiles, right through to the utterly appalling fact that there are children who've walked out into freedom, who were born into prison, have never seen the sun, never seen the sky, never seen a tree, and that is the kind of regime they were living under. So do I think that back in 2013, had we acted, Russia would have been there and Assad would have been propped up for as long as he had? I don't think that's true. I think if the West had acted faster, Assad would have been gone. Would that have led to a better Syria than the one we've had under Assad? I don't know.
We've only got 3 minutes left.
We know from our own foreign policy history, inaction is a choice, but so is action. And we've seen in other cases like Libya, where action did not lead to a better future.
I'm
so
going to have to bring the rest of the panel in.
We've made your admission. We can move on, Wes. It's fine.
I think we need to talk about the future of Syria.
Well, let's answer the question, which is how involved should the UK be in rebuilding it? You've got about a minute.
I think we need to work with our European allies to make sure that we do everything possible to make sure that the future for the Syrians is better than they have had under Assad. We need to move forward. If Trump wants nothing to do with it, then we cannot allow a vacuum into which you will get more collapse, more civil war. It is very soon, as Wes says, we have to watch very carefully what's happening, and we have to try and work with the actors on the ground to try and move towards a progressive state, the introduction, hopefully, of democracy. But we need to take our time and make sure we do it properly.
I'm so sorry to rush you, just running out of time now.
So few tears will be shed over the dismissal of Assad. And Piers is right. We called for this and tried to act on that a decade ago. But we're no longer the world's policeman. We can't do these things on our own. Christine's right. We need to act internationally. We also
do you think we should be involved in helping to rebuild Syria?
I mean, certainly there's a responsibility as part of an international effort. There's no doubt about that, because they need our help. That's beyond question. But developments in Syria, we do need to watch very, very carefully. Our enemy's enemy is not necessarily our friend, and we need to be very cautious about what's happening there in terms of the new regime.
In terms of the UK rebuilding Syria, I would just question where Israel's currently bombing Syria, where are those weapons coming from? Are they potentially being sold from Britain? So, yeah, I don't know really what the... does Britain have any kind of interest in rebuilding Syria?
Lucy, where are you? What's your view?
We need a bit.
I think that we need to learn the lessons from other experiences in that area, and I think
what you're thinking, Libya and Iraq, for example, eh?
Yeah, and also the protection of women. You talk about hopefully a progressive society, and I would absolutely hope that the UK could offer their assistance in helping create that, and we therefore could have an ally in that area, which would be very beneficial.
We can't let what happened in Afghanistan happen again. We'll chuck women back to these Taliban monsters. and we take them back 1,000 years, which is an utter betrayal of millions of Afghan women. So if we see any sign of that happening, we don't know. These rebel guys are
We have to watch very
leaders.
carefully. We have to monitor very carefully and watch very carefully and make sure that if we do get involved, that the people that we help into power are, are going to be a good force, a force for good in Syria.
I am going to end it there. I suspect it won't be the last time we talk about Syria, given events there. But for now, for our final programme of the year, for Christmas, that's it. Thank you very much to the panel. Thank you very much to all of you for taking part. And, of course, thank you to you at home for watching. Might be a bit early to say it, but since we're not back on air till the new year, happy Christmas.
Merry Christmas.
And we will see you after it. From all of us here, bye-bye.